Go ahead and get the recording started. I think we've got most participants. If you have any questions, please put them in the chat, and Matt will be moderating that, and we'll get to those questions as appropriate. And then at the end, we'll save a little bit of time as well. If there's other things that come up, we'll be happy to answer those for you. So my name is Carrie Brock. I'm head of healthcare strategy for the RTLS business at our HID Global. And I have with me Tara.
Hi, I'm Tara Jacoby, and I am the Director of Product and the owner of the Wayfinding product line here at HID Global.
So thanks again for joining us. We're going to do a brief overview on our company, talk about the evolution of healthcare RTLS, spend the majority of our time on hospital wayfinding, which Tara will take you through. We're going to talk about the benefits of wayfinding and then get into the technology a little bit about how exactly this works. So for those of you, some of you may or may not be familiar with our parent company, which is ASSA ABLOY. They're a global leader in doors and door opening solutions, operate across the globe. We have over 52,000 employees and just over $12 billion in annual revenue. HID Global, that's who we work for. We're based out of Austin, Texas. We're a division of ASSA ABLOY. We have about 4,500 employees globally, and we do billions of RFID products. And we are part of the Identification Technologies Group, or IDT. That is a business area within HID, and we design, manufacture smart components. And both Connexient, which was acquired, Tara's company, and Guard RFID, which was my company, we're part of the IoT services business area within IDT. So that explains a little bit about how we all roll together here. And we do have a history of acquisitions. Both ASSA ABLOY and HID are very much in the acquisition space. Most recently, we've been focused on RTLS acquisitions. So Guard RFID was acquired this past February, and Connexient was acquired in April. Those two companies roll into my portfolio for healthcare RTLS. And I anticipate that we'll be doing some further acquisitions in this healthcare space as well as other vertical markets. As I mentioned earlier, we're a global leader in trusted identities. We have quite an expansive portfolio across security, the ability to identify, track, well, really billions of things. We're going to talk specifically about healthcare and wayfinding today. We have a very strong, stable financial background through ASSA ABLOY, and we have a vast network of fantastic channel partners to support our customers. And specifically today, we are working on talking about acute care hospitals in North America and our wayfinding product. I'd like to just touch a little bit on the evolution of RTLS in healthcare. So maybe some of you have been in this business for the last two decades that we've really seen RTLS. It evolved with very much unit-specific use cases. So we saw it traditionally used in infant security, protecting babies. We saw it in wandering patient applications, behavioral health units, senior care, people with head injuries or other traumas where they weren't able to keep themselves safe, or maybe they were dangerous to the clinical staff or other patient populations. And then we saw staff safety being used in particularly high-risk areas. Most of it was due to either the cost of the deployment or the technology limited where hospitals were using RTLS in the early days. With the introduction of Wi-Fi around 2010, hospitals started looking at facility-wide use cases like staff safety, like asset management or asset tracking. And now with the introduction of BLE, or Bluetooth Low Energy, we see use cases for hand hygiene. We see use cases for wayfinding. Of course, we're going to touch on that today. We see much lower cost deployment options now for staff safety, far more hospitals wanting to deploy that. And we're seeing asset tracking evolving into asset management. And then where I see the market going and where I see it emerging is actually having the hospitals looking to become these smart hospitals or hospitals of the future, and actually taking some of that data from the RTLS systems and being able to look at how efficiently they're using their facilities. Where do they have bottlenecks and choke points in the facility? What's the patient workflow look like? What's the clinical workflow look like? Things like nurse call automation and other more forward-thinking use cases. We're starting to see a lot of attention on these, and that's the direction we're going to be going as we build out new products for the future. Today, we're going to focus in on wayfinding and why we think this is a step in the right direction for that smart hospital evolution. So what we mean by that is taking a look at a hospital and the way they can impact a better patient experience, the way they can make their staff more efficient, the way they can better utilize their facilities. And they're doing that through things like electronic health records. We've seen telemedicine has been around for a while, but now it is the pandemic really fast forwarded hospitals looking at ways to treat and meet with patients, be more effective, looking at the Internet of Things, AI and machine learning, RFID and RTLS solutions and digital wayfinding round out some of the applications and some of the technology that hospitals are looking at. Some of the hospitals have patient experience officers. They're looking at their informatics and other things that are making their hospital more efficient and creating a better, safer patient experience. I am now going to turn it over to Tara, and I will let her take you through the wayfinding product.
Thanks, Barry. So today we're going to take a deeper dive into our wayfinding product. As Carrie mentioned, this product line was acquired at the beginning of the year by HID, and it is a multimodal, multi-platform solution geared towards patients, visitors, and staff with the goal to ease movement throughout the hospital facility. The experience is very similar to what users are familiar with outdoor GPS applications, or turn-by-turn guidance, but it's specific to the healthcare environment. We have a door-to-door solution, so from home all the way to your appointment location and then departing the facility. The applications are customized to your environment and to your facility. And we have a number of features along the consumer journey, as I mentioned, from home to appointment and then departing. The solution's available on both iOS and Android, as well as a web-based pre-planning desktop tool and an on-site kiosk. Some of the benefits of wayfinding and the impact of wayfinding on the consumer experience. Late and missed appointments obviously impact your revenue. And then the stress and anxiety that accompanies being lost in a facility for patients or for visitors visiting their loved ones. And then, of course, the impact on staff when there's a lot of time spent in either verbally or physically providing directions to those who come on site and are lost. Now we'll start to get into how the solution works. The positioning system, which powers the turn-by-turn directions and moves the blue dot along with the user as they're moving through the facility, we will install low energy enabled beacons. This can tie into your existing Wi-Fi infrastructure if that is BLE enabled, or we can provide standalone beacons. The user's device has what we call handset sensor fusion baked into the wayfinding positioning system SDK, and that triangulates the user's position as they're moving through the facility by reading the BLE signal from the beacons. This then powers the wayfinding application, and all of the pieces come together so that you see your blue dot moving along the map on the prescribed route as you move through the facility. We've designed the solution, we like to think of this as a number of different features following along on the patient journey. So the first step is before you enter the facility, when you're at home and you're pre-planning. We have a number of different integration options that can tie into your EMRs, your your appointment reminder scheduling, um, and other early touch points to your uh, consumers, your patients and visitors. In addition, one of our most popular features is our parking planner. So this will recommend the appropriate parking location to the selected appointment location and give you the ability to save your car when you've arrived on site. We also integrate into external navigation systems like Waze, Google, or Maps, so you can get directions from your home to the campus. And then when you're inside, you switch back over to the Wayfinding application. Our desktop web-based tool is also typically used for pre-planning. This can give those patients and visitors an option who don't have the application downloaded to familiarize themselves with your campus and with where they're going to be going, with where they'll need to park. We have the capability for printouts as well. This is a tool that can be integrated into your website directly and can be shared from a number of different platforms. Once the user has arrived on site, they'll be prompted to save their car's location. And then we have a number of different waypoint features to make sure that the experience is tailored to the flow that's required from your facility. So we have the capability of allocating a registration checkpoint if there's a security or admitting or registration flow that users need to follow. And of course, they'll follow the turn-by-turn navigation, the blue dot moving along on the path. The camera will automatically adjust to the movement of the user, and they'll be given the directions at the top of the screen with what they need to do next and a distance ticker as to like where the next turn is or an elevator or escalator that they need to go up. In addition, we'll provide an off-route notification if they step off of the path and recalculation. In addition to the web-based tool and the mobile tool, we also offer the solution as a kiosk. This is a good touch point for users who haven't downloaded the app yet. We often will place these in lobbies or at entry points into the facility. It's again a robust directory of the site. Users can familiarize themselves with where they need to go. They also can get a link to download the mobile app if they want to pursue their wayfinding journey in real time using the mobile app. All of our solutions are multilingual as well, so it can provide an additional touch point for not English speaking populations coming into the facility. Once the users have made it to their appointment and are leaving, they can select return to my car. That will take them directly to the parking spot that they've previously saved. We also have the capability to touch not only patients, but visitors that are potentially either coming to pick up a patient or meet them at the facility. So we have a location sharing feature called Meet Me, where you can text out or email out your location to somebody else to follow along. We have customizable experience surveys in the application as well. This can either be about their experience using the application or about their experience visiting the facility. In addition to our multi-platform approach, we also offer the solution as either a white labeled standalone application or as an SDK. So the SDK is a software development kit, and this enables you, if you have an existing application already, to embed the Wayfinding SDK within your own application. And we've also touched a bit on the EMR integration options we have, like Epic MyChart. And this is where you can link the um, appointment reminder features and functionality of Epic with wayfinding. So if you're using the um, branded MyChart application in your configuration, you can put in a wayfinding button. So users then on the appointment screen click Take Me to My Appointment, and that launches the wayfinding application directly to where they need to go. That's also available if you're using our SDK with the MyChart mobile library is also embedded in your app. Just to touch a little bit on some of the features that are available in the app, we have a multi-campus architecture. So if you have multiple different facilities and clinics, they can all be within one application. As I mentioned, we're an end-to-end solution, so we have transitions from off-campus to on-campus, and then from on-campus to the indoor environment, we use GPS when visitors are either off-campus or outside. And then, of course, we switch to the BLE beacons for positioning inside. We're not dependent on Wi-Fi because we do use BLE as the primary source for positioning. The application has audio prompts for those that are needing uh, additional help with navigation. And we have a customizable directory for ease of finding locations, searching by categories. We also have what we call nearest me searchability. So for selected categories, um, you can search by what's closest to you rather than having to know the name. So for dining options, restrooms, elevators, things like that. Um, Showing a little video here about how the application functions. So here you see the user searching for the Skylight Cafe. That's the dining option that is closest to where they are currently located. You can see the application is fully branded. It's customizable. So during our implementation period, we will work with you to choose stylistic options like the colors of the maps, the iconography, and then, of course, we tailor all of the content to the specific locations that are within your facility, um, categorizing them as it's appropriate. You can see at the top the navigation panel with the distance ticker that counts down as the user's moving through the facility. We will often match the branding in the application to the branding that's on your signage or physical cues within the environment. One additional feature that's very popular is proximity-based alerting. So this is where we will set up regions or zones on the map, and you can have customizable messaging that's given to users as they're walking through that location. Some examples that are pretty common are reminders to pick up prescriptions as patients, visitors are moving past the pharmacy, or perhaps to um, promote certain activities that are happening on site, like a blood drive, for example. I spoke a little bit earlier about our integration into Epic MyChart. Um, this video is showing the flow of that integration. Here you're seeing the MyChart appointment reminder screen. These are all go ahead and click on that wayfinding button and it launches the wayfinding application automatically. As I mentioned, this can either be done using the MyChart white label application and the wayfinding white label application, or If you have both embedded within your application, it can be done through the SDK as well. Our web-based tool uses all of the same maps and data sets that we set up for the mobile and kiosk platforms. This is often used as a pre-planning tool to familiarize yourself with the facility before you come on site. All of our applications have these 3D models of the campus that will work with you during implementation to create. And then you can see the user here is browsing the maps, looking at different floor plans to get kind of their bearings of what they'll encounter when they come on site. In the same way that the mobile solution works, we have various location categories and all customizable branding options. All of the platforms can integrate with your physician directory. So if a user wants to select directions based on their physician's name, we can link all of that data together. And Carrie, I think I'll turn it back over to you to talk a little bit about our customers and where we've deployed so far.
Great, thanks, Tara. This is we've got over 90 hospitals deployed and 80 million square feet mapped, as it says on this slide. Some of the key deployments, we've got Houston Methodist, Hackensack Meridian, UCI. There's several others. So if you do have current hospitals that are interested in this, or you're getting inquiries or requests, just let myself or Tara know. We've put our email addresses in the slide deck, and we can also pop those into chat. We have business development managers across North America that will assist you with that, but Tara and I are happy to join you on demonstrations as you get more familiar with selling these products. We're seeing an uptick in interest in this due to, as Tara mentioned, things like, staff shortages, patients expecting technology and things to help them out. There's a lot of opportunity out there, and we'll just touch on the next slide before we get into some questions for you. So some of the reasons to choose HID and our wayfinding solution is we do have a complete healthcare RTLS portfolio. Happy to talk about those solutions as well. From the Guard RFID side, of course, we brought infant security, wandering patient. With the AllGuard platform, you can also use that to sell the BLE staff safety, the BLE asset tracking, the BLE hand hygiene. So we have a complete portfolio, and then you add in the wayfinding on top of that. It's a very compelling offer for our channel partners. You've got the strength and stability, of course, of HID Global and ASSA ABLOY. So we're obviously a much larger company than some of the other providers out there. And as Tara mentioned, this is purpose-built for healthcare. And one of the key things to remember is, as she was talking about, from getting from your home to getting to your appointment, to getting reminders, to getting back to your car, use cases in hospitals are a lot more complex. It's very different if you're going to maybe a football game or you're going into an event center or a mall. You're probably just using that while you're there, and there's no follow-up pre and post visit. So I think that's another thing when you're choosing an application and a provider for this for hospitals. Make sure that they have thought this through and that they understand the environment and some of those integrations, as Tara was mentioning, into things like Epic or that can be very beneficial to deploying a successful wayfinding solution. So I think I'll just pause there. I think Matt's got some questions in the chat that he wants us to touch on, and if there's anything that you want to ask, please feel free to do so.
Yep. So if you have questions, just type them into the Q&A or the chat, and I'll catch them there. First question we got was, does this work with my existing Wi-Fi access points?
Yeah, I can take that. So the hard requirement that we have is that the Wi-Fi access points have to be BLE enabled. Beyond that, there's some additional configuration components that we'll look at, but that's the main requirement. In addition to Wi-Fi access points, if you have any existing BLE enabled infrastructure, we can also likely work with those devices too.
So those could be from a previously installed asset tracking or a staff safety system. It would be the most likely application that you might have that could be compatible.
Yes. And one other question that typically comes up in this conversation is if we do have BLE enabled access points, but it doesn't have the breadth of coverage that's needed for wayfinding. Let's say, we don't have anything installed in garages. We can supplement with the battery powered standalone beacons to what you already have. It doesn't have to be an all or nothing system.
Great. Okay, so that's a really good point to note there. So there's a lot of flexibility in the deployment of this and ways for you to keep the cost down for hospitals. We know there's still a lot of pressure on their budgets, so you can work with our sales pre-application sales engineer. They can help you with that, getting floor plans and determining what infrastructure is already in place will help make for not only a smoother deployment, but a more cost-effective one.
Okay, the next question we got is, what is necessary for successfully implementing wayfinding?
That's a good question. I think probably Kara have something to chime in here, but I'll start and give my perspective. So I think for a hospital to do this successfully, it starts with having a patient experience strategy. So what are they trying to accomplish with this? They may have somebody in the facility on staff that's responsible for patient experience. So finding out what they're trying to accomplish, number one. Going back to the previous question, understanding the technology options and understanding where they want to put coverage and what infrastructure already exists. Another thing I would consider is the timing, like how urgent is this to roll it out, and making sure that there's a feasible implementation plan. Is it a full facility? Is it sections of a facility? Is it a whole campus? I think that's really important to understand. Tara touched on, expanding coverage to things like parkades and, are you covering areas, outside of the actual buildings? I think is another thing to be important, to consider that. Tara, anything else you'd throw in there?
I think really understanding the overall experience of the patients from start to end. So we try not just to focus on the inside of the facility, because often with wayfinding, the real challenges and pain points are, what parking garage do I use? What entrance do I walk in? When I'm leaving, where can my loved one come pick me up? So all of those touch points along the patient journey, we try to think about from a feature perspective, and you should think about while you're configuring all of the data and the maps and things to highlight those. And then somewhat, additionally to that, thinking about a lot of various places where we can connect with patients and visitors and drive adoption of the solution. I think we all know that driving adoption of a mobile app is a challenge. So you want to have, physical signage, QR codes that can be downloaded, links in appointment reminders, links in mailers, all of these different touch points, having a kiosk in the lobby that we can drive, and raise awareness to users that the solution's available to them.
And I'll just throw one last thing into there is reminding the hospital to match that signage that exists, the physical signage. So there's consistency, that brand, colors, and taking into account, people with different, potential challenges or different patient population, what's going to work for them. So if not everybody has a device, a kiosk is a great way to complement physical signage or lines on the floors or other things like that. Just making sure, or if you're referencing specific, what would you call them? Just like something that somebody sees when they walk in, if it's using those things, physical things that are on site, as markers so that somebody knows they're going the right way and incorporating those into the app. And then I think what you were saying about just how are they going to drive adoption and measure that adoption in the usage, I think is really going to be important, because if you've now sold this or they've purchased it, what is it that you're going to do to make sure that they feel that they're getting a very good return on their investment? Okay, Matt, you have anything else for us?
No, unless anyone has a question, you can drop it into the chat or in the Q&A. I think that is it. We'll give you a couple seconds to type something in if you want to ask a question. Otherwise, we'll wrap up.
And if you want to schedule a demo, obviously there's a lot more information and deeper dive that Tara can take with this. Feel free to reach out to us. And what we do is probably schedule more like 60 minutes if you have a client or if you are a facility and you'd like us to cover something off. I'd give it about 60 minutes so we can take a deeper dive on the technology side and some of the features and functionalities.
And Tara, if you move one more slide forward, you'll have the contact info there. There you go.
There we go.
Okay, we don't have anything coming in on the chat, so I think we've answered all the questions.
Oh, very much appreciate you taking time out of your busy day to join us today, and we hope to hear from you soon. So thank you.
Thank you.